All right, well, welcome everybody, and thank you again for coming, and thank you for the opportunity to come to Back Talk, for me to come to Back Talk, and I'll say thank you for all of them, and I'm sure they'll thank you as well. We'll introduce as we go, but most of you know me. I'm Keith Mankin, and I am a surgeon, but just part of the wheels that go into taking care of your spine. A lot of you have already had the fusion, but for those of you who have this ahead of you, welcome, and hopefully we'll answer a lot of questions. The whole reason behind Back Talk, and the whole reason my philosophy is to try to keep the mystery out of scoliosis as much as possible. Over the years it's had this scoliosis vibe going for it. It doesn't need to. It's really something that is very straightforward, and although everyone here who's gone through the surgery can tell you it's an ordeal, it's a doable ordeal so long as you have enough people working with you. And as you can see, we have plenty of people working, and the teamwork is very, very important. I like to start these talks when I give them with a trick question, and that is, of all the people you're going to see today, who's the most important person when it comes to the surgery? And you think, oh, he's a surgeon, he means the surgeon. The answer is absolutely not. The answer is your daughter, your child. The person who's had the surgery. That everything that we do, and you'll see every single person who talks, every care aspect is focused on the child, on the patient. And that's the way I practice. It's the way every single person you're going to see feels. And if it wasn't, they wouldn't be working with me, so straight up. So I'm not going to talk too much about the surgery, although we will have time to discuss the specifics of surgery. That's not really the place. It's more of everything that's going to happen in your very busy day. So for once, I'm going to shut up and clear out, and I'm going to turn it over to people who are going to be very busy, who were busy on the day when you had your surgery, will be busy on the day when your daughter has surgery, and get as much information as we can in a relatively short time. They'll go fairly quickly, but we'll have plenty of time, I hope, for questions. Okay? So I guess arguably it starts with the diagnosis, but we're not going to talk too much about that. We've talked at length, and I can fill in about that. But what we'll do is we'll start morning of the day of surgery, and it's a very early morning for everybody. The surgeries generally start at 7:30 in the morning, which means you have to be there like about 5:30 or so. Fill in the forms. We didn't need somebody from the clerical staff to come in and talk about filling in the forms. That wasn't necessary. But the minute you walk in the door of the pre-op area, you're greeted by child life specialists. Now, unfortunately, a child life specialist could not make it today. I will tell you that they're about the friendliest people on the face of the planet. They're wonderful. We're really blessed with really great ones at this hospital. It's really a great sign that this hospital has child life specialists, because there have been other so-called pediatric facilities that don't. But I refuse to believe that a hospital that doesn't have child life specialty is a pediatric hospital. But that's a different argument for another day. What will happen is you'll meet a lot of the nursing staff, and you'll meet the anesthesia staff. And I invited Renee Gamble, who will touch things off, who knows a lot about what the child life specialist will tell you, and also will be sort of your guide through the hospital course and through the operative course. So let me turn it over to Renee.